So this will be my presentation overview. Sorry, wait, I keep pressing. So this will be my presentation overview. I will be discussing a few of the common ENT conditions. Okay, so moving forward to the common ear conditions. Otitis media is a middle ear infection. It is a common ear condition in children characterized by inflammation and fluid buildup in the middle ear. It is usually it usually occurs after an upper respiratory tract infection, and its symptoms includes ear pain, fever, hearing loss, and for younger children, you will note them because since they cannot complain of any pain, they will be pulling or tugging the ears. So in this photo, this is how a normal ear an ear look like, and then on this the other beside it is how an ear with otitis media look like. So it looks bulging and there's fluid behind the eardrum. Okay, so if otitis media is left untreated, possible complications include hearing loss, and if you can't hear well, especially for younger children, those below 2 years of age, because they're still learning how to speak, so they may end up with speech delay. Other least common complications of otitis media includes mastoiditis, which is an infection at the bony section behind the ear. And another least common complication is meningitis, which is an infection that spreads to the membrane around the brain. So in this case, in this photo, this is a photo of a child with mastoiditis. So you will notice swelling and erythema or redness at the post-auricular area, which is an area behind the ear. So when do you need to see ENT? So symptoms, if you have symptoms that last for more than 2 to 3 days, if you have symptoms that are getting worse, if you have symptoms, if in a younger child, younger than 6 months old, if they have severe pain with fever, there's fluid, pus, or blood from the ear, and there's hearing loss, and the child keeps getting this ear infection. So treatment usually is symptomatic by giving pain relievers such as paracetamol and ibuprofen. In some cases, we may need to give a course of antibiotics. And in cases of persistent middle ear fluid, those lasting for more than 3 months, we may need to perform a surgery. We call it myringotomy and tube insertion. So as shown in this photo, we need to make a cut into the eardrum. So we suck out the fluid and put a grommet tube in. So this will keep the ears or the middle ear ventilated. Next up, we have the earwax or the impacted earwax. So wax or cerumen is a naturally occurring substance in our ear canal. So it is a mixture of dead skin cells, hair, and secretions from the glands in the ear. It plays a vital role in protecting the ear by lubricating the canal, trapping the dust and the debris, and it has antimicrobial properties that help prevent infection. If the wax and the cerumen builds up, then this will cause the impaction. So causes of wax impaction or impacted wax is the use of hearing aids, earplugs, or earbuds. And then some people have a lot of hair in the ear canal. They have certain conditions such as eczema. They commonly usually put cotton swabs or other items into their ears, and they have a misshapen ear canals that interfere with the natural wax removal. So I would like to thank my daughter for agreeing to pose for this photo, showing a person using a cotton bud. So when do you need to see an ENT? So if you have a feeling of fullness in your ear, there's ear pain, there's hearing loss, there's ringing in your ear, so we call this tinnitus, and then there's severe itchiness in your ears, and there is discharge or odor coming from your ears, and also if you have giddiness or dizziness. So this is a case of impacted earwax. So how do we treat them? So when you see an ENT, we may need to give you topical ear drops such as olive oil, docusate sodium, or hydrogen peroxide. In some centers, they still do irrigation to remove the earwax. But for our case, we do what we call an oral toilet or an ear cleaning. So I don't see adults, but for the purposes of our presentation, I asked one of my colleagues to post for this photo, and I would like to thank her for that so that you can actually visualize our actual setup when we perform our ear cleaning or oral toilet in the clinic. So this is our actual setup. We have the microscope. The microscope is attached to the monitor so you can see what we are doing. You can see your ears as well. And then you have the treatment unit that is attached to the suction. So we use, depending on the consistency of the earwax, we use micro instruments to remove the earwax, or we may use a suction for earwax removal. Okay, moving on. Another common condition that we see is a foreign body in the ear. So a foreign body is anything, any object that is lodged in the canal that is not naturally supposed to be there. So this is a common issue, particularly in young children, due to their curiosity and lack of cognitive development. So while most cases are not serious, prompt removal is crucial to prevent complications such as infection, hearing loss, or damage to the ear canal. So common symptoms includes ear pain or discomfort. You have a feeling of fullness or pressure in your ear. You have hearing loss, and you have discharge from the ear, which may be bloody or pus-filled if infected. So when do you need to seek immediate medical attention? If the object is a button battery or it's a live insect, and then there's pain, there's swelling or bleeding. So do not attempt to remove the object with a sharp object or cotton swabs, as this may push it further in and cause damage. And also, you should avoid irrigation if the object is an organic matter, such as beans, those red beans or seeds, as it may swell and become more difficult to remove. So treatment includes again the use of microscope and use of our micro instruments to remove the foreign object. This auricular deformity is not originally part of my presentation. I just added it yesterday because just this week a parent mentioned to me that they are not aware of these conditions and also the treatment options available. So they consulted us a bit late, and since consulting late may impact the success of the treatment. So due to this, I decided to include this condition to increase awareness about auricular deformities. So auricular deformities is actually one of the most common deformity in newborn. According to a paper in Nature, published in Nature in 2024, there is about 50% incidence of auricular deformities, the most common being the helical rim deformity. So any of this type of deformities does not affect hearing. However, when the children grows, they may experience psychological distress, anxiety, self-consciousness, and even have social avoidance. So for the treatment of auricular deformities, we can divide it into surgical and non-surgical treatment. Surgical treatment can be done at about 5 years of age. And then ear molding, which is a non-surgical treatment for auricular deformities, is time sensitive. So it needs to be done within the first 6 weeks of life. Otherwise, molding may be less or not effective at all. So it is important to consult your ENT specialist if your child is less than 6 weeks of age and with suspected ear deformities, or you're unsure about the condition, so that we can assess whether ear molding can be done, so therefore we can correct it early. Okay, so that's it for the ear disorders. Now let's move on to the nose disorders. So allergic rhinitis. So it's an inflammation of the nasal passages triggered by allergens such as pollen, dust mites, or pet dander. Its symptoms include blocked nose, runny nose, bouts of sneezing, itchy nose and throat. You breathe through your mouth, and then throat clearing and even coughing. And because of this condition, it also can disturb or disrupt your sleep. So when do you need to see ENT? If your symptoms is not managed by the over-the-counter drugs such as your antihistamines, cetirizine, Telfast, or your decongestants such as your Iliadine nose drops. So if you also have unusual symptoms such as headache, nose bleeding, you have one-sided nasal blockage, and the loss of smell. And also when you have persistent or recurrent symptoms. And if the symptoms impact your sleep, your work, or your daily activities. So how do we treat allergic rhinitis? I think, okay, I think the proper term should be, how do we control allergic rhinitis? Because there's really no permanent cure or treatment for allergic rhinitis. We can only control it by using intranasal steroid spray, such as Avamys and Nasonex, and then antihistamines such as Zyrtex and Loratadine. And more importantly, also avoid allergens. Okay, the other common condition in children is epistaxis or nose bleeding. So this often results from dry nasal passages, nose peaking, or forceful blowing of the nose associated with allergic rhinitis. So for during an acute episode of nosebleeds, you should ask the child to sit upright and lean forward. So this to prevent them from swallowing blood, and then ask the child to pinch the soft part of the nose just above the nostril firmly for 10 minutes. So you don't let go when you pinch the nose. So this is a continuous pressing for 10 minutes. And then you just ask the child to breathe through the mouth during the pinching period. And you can apply cold compress, or if the child is old enough to gargle, you can ask them to gargle some ice cold water, as this could constrict the blood vessels, therefore controlling or minimizing the bleeding. Also, you should ask the child to avoid blowing or picking the nose for a few hours after the nosebleed. So when to seek an emergency care when you have epistaxis or nose bleeding? When it involves massive bleeding or makes breathing difficult, it causes your child to become pale, fatigued, and disoriented. The bleeding does not stop for more than 15 minutes, even with a proper first aid technique. And it occurs after an injury, such as after being hit on the face or the nose. It will not stop, and your child has other areas of bleeding or multiple bruising over his body. So, when to see ENT? When you have frequent nosebleeds for about 4 to 5 minutes in a month, and it's difficult to control, and the nosebleed is accompanied by other symptoms, and if it disrupts the child's daily activities. So, what do we do? How do we treat epistaxis? Your ENT doctor may perform a nasoendoscopy, in which a flexible scope. So in this photo, I'm holding a flexible nasoendoscope. This is like a tiny straw that with a camera that is inserted into both your nostril and all the way to the back of the nose and the throat. And then this is to look for any masses in the nose that can cause bleeding. A cautery of septal vessels is an option if the child has daily or weekly epistaxis, and if it disrupts the child's daily activities. And lastly, it is important to control your allergy or sensitive nose in order for you to control or minimize epistaxis. If we have ear foreign body, we nasal foreign body is also very common, because children may insert any foreign objects into their nostril. So a nasal foreign body may lead to an infection or even worse, aspiration. So the common symptoms of foreign body in the nose includes a one-sided or a unilateral nasal obstruction, as one-sided nasal discharge, pain or irritation, sneezing or coughing, and bleeding. So when do you see ENT? If the person is having trouble breathing or is choking, if the object is a battery or sharp object, if there are signs of infection such as fever or pus-like discharge, if the object has been lodged for an extended period, if you are unsure or concerned about the situation. Let's say, for example, you really saw the child putting in something into the nose, but when you check, you can't see anything, then it's best to consult an ENT, just to ensure that there's really no foreign object in the nose. In this photo, this is a case of a child who inserted a button battery into the left nostril. So the danger of having a button battery in the nose is it can cause injury into your septum, which is actually the mid partition of your nose, and then it can cause tissue damage, and then it will lead to what we call a septal perforation. So what to avoid? Don't try to blindly remove it with tools, as this can push the object further in. It can cause further damage. Also, avoid using tweezers or other tools if the object is deep or is not easily visible. And don't repeatedly blow your nose hard, as this can also push the object in further. How do we treat foreign bodies? We have this rigid nasal endoscope that aids us in removing or visualizing the foreign object. And also we have these tools. So depending on the shape of the foreign object, the size of the foreign objects, we use these instruments. Okay, so we are done with the nose. We would move on to the throat. So tonsillitis is a common infection causing inflammation of the tonsils. It is usually caused by viruses or bacteria. Symptoms include your sore throat. You may have a red swollen tonsils with white or yellow spots. You have fever. You have a swollen lymph node. You may have bad breath or halitosis. And other symptoms include headache and a muffled or hoarse voice. um, you need to seek immediate medical attention when you're having severe throat pain or ear pain, not relieved by medications. You have difficulty breathing or swallowing. You have difficulty opening your mouth. You have high fever. There's a large amount of bleeding from the throat, and you have prolonged or concerning symptoms. So for this case, other than the tonsils being enlarged, you will notice that there is also swelling around the tonsil. So we call this a peritonsillar abscess or a quinsy. So the difference is this child may need an additional surgery to drain the pus surrounding the tonsil. So when do you see ENT? When you have severe symptoms, when you have persistent symptoms lasting for more than 4 days without improvement, and if you have recurrent tonsillitis, and you have other symptoms alongside the tonsillitis. So it's best that the specialist can assess the overall picture and provide appropriate care. So how do we treat tonsillitis? We give symptomatic treatment such as giving pain relievers, paracetamol and ibuprofen. We also give a course of antibiotic. For cases of recurrent tonsillitis, the child may need surgery. And also for like for the case I mentioned earlier, the case of peritonsillar abscess or quinsy, we call it, the child may need drainage for the abscess. Okay, so lastly, we have snoring in children. So this is caused by vibration or flapping of the tissues lining the upper passages. Loud and regular nightly snoring is often abnormal in an otherwise healthy child. So snoring may be associated with obstructive sleep apnea, in which breathing is interrupted during sleep. So OSA, or obstructive sleep apnea, involves pauses in breathing during sleep, and can cause fatigue and behavioral issues in children. The common causes of snoring includes enlarged tonsils and adenoids. So adenoid is tonsil behind the nose. So if you have an enlarged tonsils and adenoids, it can obstruct the airflow during sleep, leading to snoring. Nasal congestion, either because of your allergic rhinitis, colds, or sinus infection. This can cause the nasal passages to swell, resulting in snoring. And lastly, obesity and excess weight can contribute to the extra tissue in the throat, narrowing the airway. So when do you see ENT? If the child has loud, persistent snoring, if the snoring is accompanied by pauses in breathing, the child has daytime sleepiness or fatigue. He's using the mouth to breathe. There's restless sleep, so he keeps tossing and turning during sleep. There is behavioral or academic difficulties. And there are other symptoms such as nasal congestion, frequent ear infections, or difficulty swallowing, which can also be related to snoring. Okay, so treatment. Very important. Weight management and allergic rhinitis control is very important, because if you don't do this, even if you go for surgery, the snoring may come back. And then there is what we call continuous positive airway pressure. So we are CPAP. So this is a non-surgical treatment for obstructive sleep apnea. The machine aims to deliver a constant and steady air pressure to help you breathe while you sleep. So as shown in this photo. And of course, lastly is surgery. So removal of both tonsils and adenoids, and also shrinking of the turbinates, which is actually a tissue inside your nose that swells when you have sensitive nose or when you're having flu. Okay. So early consultation with an ENT specialist can prevent complications, it support normal development and improve the quality of life. Timely treatment is key to successful outcomes in pediatric ENT conditions. How to get an ENT appointment? So in Singapore, you can visit your nearest polyclinic or GP, or to get a referral to see an ENT specialist. You can also walk into your private ENT. And for emergency cases, you can always visit the children's emergency. There is always an ENT on call to attend to you. So in conclusion, pediatric ENT conditions are common but manageable with timely recognition and specialist care. Understanding the symptoms and knowing when to consult an ENT specialist ensures the best health outcomes for children. So I thank everyone for listening. Um, if you want further information, you can always visit the SingHealth website or the KKH website for more information with regards to the conditions I mentioned. So with that, I'm open to questions if you have any questions.
Thank you very much, Dr. Rosslyn Anicete. Let's give her a round of applause, especially for those who are watching us on FB Live and also here in Zoom. Before we proceed with our question and answer, I think Bayanihan Center or PBSS would like to share some video first with regards to their Bayanihan walk as we are waiting and concluding all of the questions from FB Live as well as here at the Zoom. Okay, I would like to call on our video control manager.
Every step tells a story of unity, hope, and hope. More than just a walk, it's the Bayanihan spirit in motion. A day of fun, culture, and togetherness. Your walk helps improve our shared home, the Bayanihan Center. Join us in the next Bayanihan Walk. Walk with purpose, walk for Bayanihan.
Thank you very much. All right, let's get back to question and answer portion. Okay, once again, let us welcome our resource speaker, Dr. Rosslyn Anicete. We have a question here. Okay, the first question is that, is allergic rhinitis a permanent condition? Doctora.
Okay, so allergic rhinitis, I wouldn't say it's a permanent condition. Okay. The proper term is there's no permanent cure for allergic rhinitis. The medications we're giving is just to control the symptoms such as blocked nose, runny nose, sneezing. So as I mentioned earlier, it's very important to have the allergy control. So in Singapore, the most common cause of allergic rhinitis is the dust mite. So yung dust mite, you find them in your bed sheets, your pillowcases, stuffed toys. So I always tell my patients, because children mostly they have a lot of soft toys. So you need to get rid of the soft toys. Your bed sheets, your pillowcases, you need to wash them every week in hot water about 60 degrees. So this is to minimize, you cannot totally remove the dust mite, but at least minimize your exposure to dust mite. So when you do this, plus you control it with medications, then you may be able to control the symptoms. So it's like eczema. So there will be good days, there will be bad days.
Okay, thank you very much, Dr. Roslyn. So, allergic rhinitis can be controlled.
Controlled, yes.
Yan. Okay, another question from one of our participants. It says that, is it true that eating too much chocolate can cause tonsillitis? Doctora.
Okay, so no. Okay. Okay. Because even in Singapore, normally they will ask us about heaty food. And then heat chocolate is considered, but actually no. The causes of tonsillitis is, to answer your question, is no. So the cause of tonsillitis is really viral or bacterial infection. Like,
Wow.
getting flu.
Okay, thank you, Doctora, and I'm happy to hear that. So I can
So you can
continue
eat
eating
chocolate,
sweets
yes.
and chocolate. Okay, but in a moderate portion, as we are trying to avoid diabetes as well.
Ah, yes,
All
okay.
right.
And also drink
Okay,
water after you need to drink water after eating chocolates. Yeah.
exactly. Thank you very much, Doctora. We have another question from FB Live. It says that how can parents tell if a child's cough or sore throat is caused by a post-nasal drip? And what treatments over the counter medicine are available for children with persistent post-nasal drip?
Okay. So, okay, it's a bit usually, okay, if the cough is persistent, and let's say if the child presented with cough, you have fever, then most likely that's flu. But if you don't have fever and then the child keeps coughing, one consideration would be a postnasal drip. And then if you have other symptoms, not only cough but blocked nose, runny nose, sneezing, then it leads more to a postnasal drip, which is part of the allergic rhinitis symptoms. But you also need to consider, if it's a persistent cough with no blocked nose, no runny nose, then you might consider asthma or a sensitive airways as well.
Hmm.
Mm.
Okay. So that's quite complicated. I think
Yes,
it would be best to also consult the
consult, correct,
ENT,
consult,
yes,
yes.
to for
So
proper
something that
diagnosis.
it's something, some conditions that does not really improve, does not go away. Let's say you have been trying cetirizine over-the-counter medications, such as your cough mixture, um, antihistamines, let's say for 1 week, and then you still have persistent cough, and then it doesn't it disrupts your sleep, your daily activities, then yeah, I think it's time either to consult your GP first. At least they can give you proper medications, and then listen to your lungs just to ensure that it's not sensitive airway, especially for children. And then, if let's say they give you medications and then 2 weeks after taking this medication, still no improvement, then they will refer you to the appropriate specialty, either ENT or maybe the the peds medical side, to rule out any sensitive airways or allergic nose.
Okay, thank you once again. Another question here. What causes frequent nosebleeds in children and when should I worry?
Okay, the frequent nosebleeds in children is caused by usually dry nose. It's also associated with allergic rhinitis. And then the bleeding normally comes from these tiny vessels in your nose. We call it the Little's area. So you should be alarmed when, let's say, after pressing for 10 minutes, more than 15 minutes, it does not stop. And then it's very frequent, like 4 to 5 times in a week. The child keeps getting nosebleeds, and then it's getting more difficult to stop. Then best to see an ENT so that we can assess whether it's due to just allergic rhinitis alone or from Little's area bleed, or there's something else that we would need to look out for.
Okay, thank you very much, Doctora. There's a follow-up question with regards to dasmite. It is said that dasmites could be on the soft toys, and washing the pillowcases and the bed sheets could prevent the dasmites. How about how frequent would you suggest to the parents for replacing the pillows and the bed mattresses?
Oh,
What
the
is the recommended frequency?
Okay, for the mattress, actually it's because mattresses are quite expensive.
Mm.
So you can vacuum them. So there's actually, you can, an alternative would be vacuuming them. But with regards to the recommendation on changing, there are some papers that say at least 10 years. After 10 years of an old mattress, and you should need to replace it. Pillows for about 1 to 2 years. But you can also wash your pillows and then sun them actually.
Mm. Okay.
Sun, or actually, same thing, also wash them in hot water.
Okay. Thank you, Doctora. Any more questions from Zoom and also from FB Live? Okay, how about from our participants here at Zoom? Any live questions you would like to ask our resource speaker? Okay, it seems to be that would be all the questions, Doctora. Once again, we would like
Okay.
to thank you very much for um, giving your time and your, of course, your knowledge for our viewers and also for to be our resource speaker here at the Bayanihan Talk webinar series.
Okay.
Okay, sorry. There's one more question. It says, what are the treatment options for recurrent, hold on. Okay, it says, what are the treatment options for recurrent ear infections in children?
Oh, okay. For recurrent ear infection in children, if it's we need to investigate whether because it may be linked to what we call an adenoid hypertrophy. So adenoid is actually a tonsil behind the nose. If you keep getting the recurrent infection, that's one. So you might need to perform a surgery we call adenoidectomy. And then number two, we need to insert in a grommet tube. So like what I showed in the photo earlier. So this is to drain out the water. If this is a recurrent otitis media or a recurrent middle ear infection.
Okay, thank you very much, Doctora. Would like to check again with the Bayanihan staff. Are there more questions on FB Live? Okay, this time it's for real. That concludes
Okay.
all the question and answer. Oh, of course, we are really grateful for you, Doctora, for having you as our guest and resource speaker here at Bayanihan Talk webinar series. What you had discussed had really opened our eyes on how we're going to help our children with regards to the ear, nose, and throat issues or whatever they're going through. And thank you very much on giving us all this information. It's very handful, especially for us who are here in Singapore, as allergies, rhinitis, or even tonsillitis are quite frequent for our children. All right, with that, let's give her a round of applause. Yan. Okay, let me share with you to our viewers what is the Philippine Bayanihan Society. Philippine Bayanihan Society Singapore, or PBSS, is the 2021 Philippine Presidential Awardee Kaanib ng Bayan. Yan. Where do we find the Philippine Bayanihan Society Singapore? Bayanihan Center, for short, is located at the 43 Pasir Panjang Road. And if you would like to connect with them or would like to ask something about what the Bayanihan Center can offer you can contact them at bayanihancenter@singnet.com.sg via email. Of course, you can also call their main line, which is 64743700. By the way, to all our viewers, Bayanihan Center offers different courses for upskilling our mga kababayan or even our locals here are welcome to join us. Of course, we have also our social media presence. Please like our Facebook page, which is Bayanihan Society SG. We are also available on Instagram at Bayanihan Society SG. And please support us by going to the website https://www.giving.sg/PBSS. Please subscribe also to our YouTube, Philippine Bayanihan Society Singapore. For sponsorship opportunities, please contact our email address, bayanihancenter@singnet.com.sg. All right? For donations, please kindly put through Pay Now. You can use the UEN number or the unique entity number, which is T01 SS0179C, or you can scan this QR code. All right. We have an upcoming event this coming October 5. It is on Sunday and it is called the Magbayanihan sa Bayanihan. So this is the yearly Bayanihan Walk. And every year we have this walk to raise funds. If you would like to if you would like to be one of the sponsors, please contact us by email at bayanihanwalk@gmail.com. And if you would like to support them, you can register at the Bayanihan Walk by scanning the QR code earlier on, or you can check our social media pages or websites for more information. Okay, thank you all very much for joining us today for our Bayanihan Talk series. We hope this had been a fruitful discussion for each one of you, and we hope to see you on our next Bayanihan webinar. For more information on our next Bayanihan Talk webinar series 2025, you can check our Facebook, Instagram, YouTube, and also our website. With that, I wish you all a great night. God bless you all. Have a magnificent rest. I would like to thank also all the participants and those who watch us at the Facebook Live. Thank you. Bye.